Remember that you had the IPO market, that is a buzz, and we have the latest IPO management joining us on the show. We have Mr. Sachin Gupta, who's a whole-time director and chief executive officer at IKS Health, joining us on the show. Along with him, we also have Nithya Balasubramanian, who's the chief financial officer at IKS Health. A very good afternoon to both of you. Thank you so much for joining us. And yes, you have the IPO that's open. We wanted to understand, you are a very niche player in the segment. If you could talk about the offerings of the company and what should one actually watch out for while subscribing to your IPO.
Thank you for having us on the show. Look, I think IKS Health is built on the thesis of the opportunity set that exists in US healthcare. As you might know, US healthcare is a $4.8 trillion industry, larger than India's entire GDP, growing at 7% in a secular manner. And when we started the business, US healthcare had some existential issues around the cost of care, quality of care, and access to care delivery. And in order to help with that issues, we decided to focus on one of the segments of the US healthcare market called the provider segment. And within the provider segment, instead of the hospital segment, we decided to focus on the physician groups, the physician clinic business, which is a $1.5 trillion market, growing at about 7%. And our simple thesis was that as we try to solve for cost, quality, and access in a world where the primary drivers of cost are chronic lifestyle disease due to the aging populations and sedentary lifestyles, the reality is healthcare will have to transform into a model where physicians start taking care of proactively of their patients and trying to preempt episodes of care in a way that it doesn't lead to hospitalizations and more expensive points of care. And so within that market, the way we decided to solve the problem was by helping these physician groups delegate what we call chore tasks, the tasks that they should not be focused on, that take them away from patient care so that they could focus on patient care. And the reality is these guys are spending as much as $225 billion on these chore tasks. So just to put it in perspective, the entire Indian IT services outsourcing industry is about $250 billion. We had found a TAM that's about $225 billion, growing at 7%. And we basically built a platform at the combination of proprietary technology that is then supervised by our global human capital, predominantly based in India, so that we can take away all these chore tasks from these physician practices so that they can focus on their core. And we do that because we do that using a combination predominantly of technology and people. We've been able to build this model in a way where we have industry-leading unit economics. Traditionally, our EBITDA margins have been 38-39% at an organic growth rate of nearly 27% on a standalone basis prior to the acquisition that we did last year, which has further expanded our growth prospects pretty dramatically. The other thing that's interesting is, of this $225 billion that's being spent on these tasks today, only 30 billion has been outsourced so far. And that 30 billion is growing much more faster than the industry itself at about 12%. So at the confluence of the way we've built our platform, its scalability, our growth prospects within our existing customer base of 155,000 physicians, we feel like we built an outsized growth opportunity for the future.
Sir, you serve nearly 778 clients in total. What is the run rate of client addition that you have seen in the company, and what can we expect going forward?
So the way to think about this business is, the physician market in the US is consolidating very rapidly. And so we deliberately built a business that was focused on the consolidators, which are the physician groups that are buying all the other groups versus the ones getting consolidated. Because then the consolidators keep buying everybody else. Their natural inorganic growth becomes our natural organic growth. So actually the holy grail to our outsized growth is not acquiring a whole number of new logos, but it's really growing and cross-selling all the 16 features of our platform across the logos that we have already acquired. So about 85 to 90% of our growth every year typically is reflected in the cross-sell and growth of our existing customers, and only about 10 to 15% comes from new logo addition.
If you like this video, then like, share and subscribe to ET Now.